we're looking at a spinal degeneration model, and you can see on this side would be a normal, healthy vertebrae and disc. And not only does the spine look healthy, but these holes in the side of the spine are nice and wide open for that nerve to flow through with no problems whatsoever. But in many cases, when an injury occurs, there'll be compression or pressure along that disc, and you begin to see swelling and inflammation occur. Now, if that condition is not treated at that time, over several months or possibly years, we're going to see that disc get worn down, just like you see in this example. And as that disc begins to get flattened and it loses the fluid, we start to see bone spurs, or what's called degenerative joint disease, begin to develop. And then we see a loss of motion. The person notices that maybe it's difficult to turn their head to the left or right, or they can't bend over in their lower back like they used to. And in many cases, they even tell me that, yes, it sounds like there's gravel in my neck, or there's some kind of a crunching noise whenever they try to move their spine in a certain way. Now, if they still don't get this condition under control at this level, eventually what will happen is it will fuse, and it will look just like this, where that disc now is completely gone, the vertebrae have completely fused together, and those holes where the nerve exits are almost completely closed off. And it's very difficult at this point to treat, although we are successful in many cases, and we try to help avoid surgery, which may be the only option at that point. So for a chiropractic patient, it makes sense to get started early on, but we are able to help patients through this process at different levels, but it's important to get your spine checked and evaluated before it gets to this point.